Hello everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is Major Depressive Disorder, also known as MDD? Okay, let's get into what Major Depressive Disorder is, also known as MDD. There's one thing I need to say before I get to that, which is that this is not diagnostic criteria. This is merely a description of Major Depressive Disorder, so do not use this to diagnose somebody. Anyway, you should be seeing a professional if you're seeking a diagnosis. Also, if the label Major Depressive Disorder bothers you in any way, if it doesn't help you to heal or a loved one that you know that may be going through this heal, then don't use the label, that's okay. This is merely to point you towards something that may be going on in your life or the life of someone that you love. And with that said, let's get into what Major Depressive Disorder is. I have a lot of notes here. This is a very wide topic, so I'm going to breeze through it as quickly as I can, and you'll see me looking down a lot because there's a lot to cover here. So Major Depressive Disorder is something that happens, and it has a set of things that are going on. So during any 2-week period, there has to be either a depressed mood or a diminished interest in pleasure in most activities. And this has to happen most of the day, nearly all day, every day. And this can be something that's seen by yourself, or it could be other people see it in you. So one of those two things have to be happening: depressed mood or diminished interest in pleasurable activities. And then you're going to see most of this stuff going on. So significant changes in appetite and weight. In children, it would be a failure to reach the age-appropriate weight that's happening. You have insomnia or hypersomnia almost every day, excessive activity or slowed activity. So things like fidgeting and pulling at your clothes might be excessive activity, and you may have slowed speech or slowed reactions to things as a slowed activity. And this must be something that's observable by others. It can't just be you describing it. Now, you can have fatigue or loss of energy nearly every day is another thing that happens. You may have excessive or inappropriate guilt, possibly delusional guilt, and feelings of worthlessness nearly every day. Diminished ability to concentrate, having indecisiveness, hard time making decisions nearly every day. And this is something that can be observed by others or yourself. And you have recurring thoughts about death, suicidal ideation without a specific plan or a suicide attempt, but you may also have a plan or a suicide attempt. So all of this has to cause significant disturbance to everyday functioning, whether it's work or friendships or however. And you can't have this, all of this can't be due to a substance, using a substance or a medical condition. Now, what I've described is what can be considered a major depressive episode, which is also known as MDE. So all of that umbrella, it's part of major depressive disorder, but you could also call it a major depressive episode. And something to note about this is that responses to significant loss, if a loved one dies or something, then that may or may not constitute a major depressive episode. So you want to take care in distinguishing whether what's going on is a major depressive episode or if it's just normal grieving. And I'm going to go over a few things to distinguish the two of them. So grieving looks like feelings of loss and emptiness, and depression is depressed mood or inability to experience pleasure. Grieving, it comes in waves, while depression is more persistent. Grieving may feature happy and positive moods, while depression's more of a pervasive unhappiness. Grieving has thoughts and memories about what was lost, whereas depression, the thoughts are more focused on self-criticism and rumination. When it's grieving, you have your self-esteem fairly remains intact. If there's any self-derogatory feelings, they're probably related to some kind of feeling that you failed whatever it is that you lost, or a person that you lost. And when it comes to depression, the feelings of self-loathing and worthlessness are there, and they're just pervasive. When it comes to grieving, you have thoughts about death, and they're all linked to whatever was lost or whoever was lost. And when it comes to depression, thoughts about death are just linked to feeling worthless, unable to bear the pain of the depression, and feeling undeserving of life. So important to separate, is this normal grieving or is this a major depressive episode? Now, we're still talking about major depression here, and that is something that is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum disorders, or psychotic disorders. And it's important to note that during all of this stuff that we've described, there has never been a manic or hypomanic episode, but that does not apply if you've had a manic or a hypomanic episode when a substance or a medication induced that episode. So that was a big mouthful, but we're still not done. There are specifiers. There's many different specifiers to help us understand what's going on when it comes to major depressive disorder. So I'm going to go through them quickly here. First, you have just different ways of classifying it in terms of severity. So you've got mild, moderate, and severe, and that really just comes down to how much of each of those things I described you're experiencing. And then we have different ways to specify what's going on. So you have in partial remission, which is when there's been a period of less than 2 months when there have been no symptoms present, or a period where the full criteria for the disorder have not been met, or in full remission, which is when in the past 2 months no symptoms were present at all. And that would be towards the path of healing. Hopefully you go into a remission. Sometimes there are brief periods of remission in between depressive episodes. So you may have major depressive disorder and you just go from a depressive episode to a remission to an episode to a remission in a cycle. But best case scenario is that it would fully remit and you wouldn't have the disorder any longer. Now we have depressive disorder with major depressive disorder with anxious distress. And for that to be specified, then you have to have at least 2 of these: tense feelings, restless feelings, trouble concentrating because of worry, fear that something awful is going to happen, or feeling that you might lose control of yourself. Now, if you have with anxious distress, that indicates a longer duration of the symptoms, a higher suicide risk, and greater likelihood of treatment non-response. So that would be important to know. There's also the specifier of with mixed features, in which case you have to have at least 3 of these. So expansive elevated mood, grandiosity or inflated self-esteem, pressure to keep talking or more talkative than usual, racing thoughts or flight of ideas, increase in goal-directed activity and energy, increased involvement in activities that have high potential for painful consequences, so things like overspending, poor investments, or sexual promiscuity, and also decreased need for sleep, which is feeling rested even though you've had less sleep than you normally would have. So any 3 of those. And when you have with mixed features, it has to be something that's observable by others, and it's a change from your normal, usual behavior. And if the symptoms meet criteria for a mania, then a bipolar diagnosis is appropriate. If there's all of this has to happen that's not due to a substance. And when you have a mixed feature specifier, then it indicates a significant risk factor for the development of bipolar 1 or 2 disorders. There's also the specifier of with melancholic features. Now, to have this specifier, then there has to be at least 1 of these during the most severe period of a depressive episode. So either loss of pleasure in almost all or all activities, or no reaction to things that are usually pleasurable. So you have to have 1 of those, and you also have to have at least 3 of these. Profound despair, moroseness, or despondency caused by the depressed mood, depression being worse in the morning, waking at least 2 hours before usual awakening, excessive activity or slowed activity, significant weight loss or anorexia, and inappropriate or excessive guilt. So all of that taken together is with melancholic features, and when you have that specifier, it indicates that there's more likely to occur it's something that's more likely to occur in severe depression and in depression with psychotic features. There's also the specifier of with atypical features, which does not mean that it's an uncommon or unusual form of depression. It's just the label that they use for the specifier, and it's features mood reactivity, so your mood brightens for a period, and you have to have 2 or more of the following for it to be atypical features. So significant increase in appetite or weight, hypersomnia, leaden paralysis, which is when your limbs feel very heavy, long pattern of rejection, sensitivity that limits functioning, and that's a trait. So also, if you're going to have atypical features, it can't be with melancholic features or with catatonia. There's another specifier with psychotic features. So to have this, there are delusions or hallucinations present. So you have with mood congruent psychotic features, which it contains delusions and or hallucinations that are consistent with depressive themes like nihilism, disease, death, personal inadequacy, guilt, and deserved punishment. Or you have mood incongruent, with mood incongruent psychotic features, which has delusions or hallucinations that do not involve those themes, or it's a mixture of involving those themes and not involving those themes. There's also the specifier of with catatonia, which features catatonia, and I'll do another video on what that is, just to not bog down this video. There's the specifier of with peripartum onset, which means that symptoms occur during pregnancy or the 4 weeks following delivery. It's something that 3 to 6% of women will experience. There's 50% of instances begin prior to the delivery of the baby, and they can feature psychotic episodes which may lead to infanticide. So it's important to note the specifier. There's also with seasonal pattern. So that is when there's a major time relationship between onset of episodes, for example, fall or winter. And that does not include when there are regular seasonal stressors. So if you get laid off during a certain season constantly, that would not qualify you for this specifier. It's in full remission, also occurring during a characteristic time of the year. So for example, it clears up in the spring, returns in the fall. It's something that's happened in the last 2 years with no non-seasonal depressive episodes occurring. Seasonal episodes are greatly outnumbering non-seasonal episodes during your entire lifetime, and you have higher latitudes and younger age increase the risk for recurring winter episodes. Okay, all of that said, treatment for major depressive disorder includes cognitive behavioral therapy, psychodynamic therapy, interpersonal therapy, and medication. Of course, the best thing to do, especially because this is a very complicated disorder, is to go in and see a therapist, and they'll put together a treatment plan with you, specifically for whatever is going on in your situation. And since there is a risk for suicide, I just want to mention that there are free hotlines, there are text lines and chat lines, and all kinds of things available in most countries. So please, if you're feeling suicidal, go ahead and check those out. They're free resources, and there's no shame in using them at all. The people are trained to help you on those lines. Now, approximately 7% of the population has a 12-month prevalence of major depressive disorder. And I wanted to make a note that there is also a high-functioning form of this disorder. It's not like an official thing, but it's when people don't see that the depression is there because people who have it can function in their daily life, and it's not so clear what's going on. So now let's quickly get into what it feels like for the person with major depressive disorder. In their body, they're going to experience things like insomnia or hypersomnia, fatigue or excessive energy, change in their weight or their appetite, and they may have anxiety symptoms, aches and pains. When it comes to their thoughts, they may have trouble thinking or concentrating, trouble making decisions, difficulty recalling things, thoughts of death, suicidal ideation, and inappropriate self-blame. Emotionally, they're going to feel intense sadness. They may have anhedonia or alexithymia, where they have trouble experiencing pleasure or trouble describing the way that they feel. They may have melancholy. Children get irritable. In adults, it becomes anger. They may have guilt. They have low self-esteem and self-worth, or a feeling of hopelessness. And if you have this, some behaviors you may exhibit are outbursts. You may withdraw socially. You may neglect pleasurable activities. You may find you have less desire and interest in sex, trouble sitting still. You may pick at things, slowed speech and reactions, poor performance in school or at work, and you may prepare for or actually attempt suicide. So this is a very complicated disorder. I hope I've given you a good comprehensive overview of what it looks like and a good experience, a human perspective and experience of what it is. If you have an experience you'd love to share with your experience of major depressive disorder or someone you love, I'd love to hear it, so please leave it below, and I thank you for taking the time to learn about it today with me. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.